Okay, so you're looking for these variables. The person has social anxiety. How do you dig in a little more in terms of how you assess the manifestation of the social anxiety specifically?
I will look, first I will go with what's their daily routine. Are they in school? Are they working? Perhaps they're avoiding school or work. Perhaps they're unemployed. A common scenario may be that patient has not been able to sustain a promotion, possibly because of not being able to speak up, not able to voice their ideas in board meetings or speak with their boss out of fear of rejection or criticism. So I really need to gauge what the level of dysfunction is, and certainly the array of social situations. Is it something that's present only when the patient is public speaking? Is it a more pervasive, generalized condition as to when they're all day at work, in all their social interactions? And just the full degree of impairment is really necessary to ascertain in this first interview.
And again, the primary conditions, comorbid conditions that go along with social anxiety that you have experienced have been what?
The main conditions are actually mood disorders, anxiety disorders, substance use disorders, and personality disorders. Best estimates are really that patients with social anxiety will have about a 54% chance of having another anxiety disorder, 56% chance of having a mood disorder, and a 55% of having a personality disorder. Now, substance abuse is quite common, and about 48% of these patients also have alcohol use disorders, and about 22% will have drug use disorders. Drilling down a little further into the specific illnesses, generalized anxiety will occur in about 23% of patients, panic disorder in approximately 22%, major depression would be more like 34%, bipolar disorder 16%, dysthymia about 11.5%, and bipolar 2 about 3.7%. The most common personality disorder we see with these patients is avoidant personality disorder, and that's been found to be present in about 23% of these patients.